Good morning, ladies and gentlemen. Today we are seeing a video in which we are performing a surgery. It's a minimally invasive crown lengthening due to caries distal to the tooth number 35, and distal, the tooth number 36 and 37 are actually two implants, and they are very near. And the patient is pretty old, is almost 80 years old. And you see the quality of the tissue is pretty good, not perfect, but pretty good. And probing a little bit deep, I caused some bleeding on probing, but with a normal probe force, it will not bleed. Now we are injecting the anesthesia apical in the alveolar mucosa. This is made with a wand, with a very slow injection, long-term injection. It goes very slow, so it's very good for the patient, and with normal amount of articaine. The issue of this surgery is the fact that the patient has a cavity distal of the tooth number 35, but immediately distal there is an implant, and the implant is a good bone stability, mesial, but distal has some problems. So we don't want to create bigger problems. So we start with an instrument for tunneling, and we don't want to elevate any flap. So just with a minimally invasive approach, we just elevate very gently from the sulcus. We enter and we are going to raise a small flap. The aim is to do this full thickness, because this is not a tunneling technique. This is just a way to create the space for ultrasonic instruments to remove the level of attachment, with the aim to recreate the supercrestal attachment thick enough, respecting the dimension of the supercrestal attachment, so the restorative guy, in this case Dr. Samuele Chiapparoli, can finalize the prosthetic work and actually the restorative with adhesive dentistry work. As you can see, we are elevating a little bit the tissue, the soft tissue from the bone, in this area distal to the papilla. And just a little bit to be able to elevate. The aim is don't damage the mesial surface of the implant number 36. You will understand that from the X-ray at the very end of the video. And this is the instruments. As you can see, this instrument is flat in two sides, and is diamond. We are moving a little bit here, and okay, and you see is diamond on the head. So it's flat from the two sides, and on the head is with diamond powder, as you can see nicely here. And as you've seen from the measurements, the diameter is 3 millimeters. So when these appear into the sulcus, you know that you are deep 3 millimeters. You use as a probe as well. And this is a normal device for ultrasonic instruments attached to the unit. Of course, we use this tool with irrigation. And now we can adapt. It will not harm the tooth, and will not harm the soft tissue. Just remove the attachment supercrestally. And I have to say, if you use a brand new instrument, it's pretty quick. If the instrument has been used a few times, of course, it takes a little bit more time, because the diamond particles are a little bit more not so sharp, let's say. And so as you can see, it's a very easy atraumatic procedure for the patient. There is only some water in the mouth, and There is basically no bleeding. For this aged patient, it's very good, this type of procedure. And now I try to show also in the lingual aspect, of course, as any concept of crown lengthening, we need to remove enough crestal bone to allow to the soft tissue to have at least 2 millimeters and a half of healthy dentin to be attached, for the attachment to be reattached, and before of the cavities. In this way, the restorative guy is able to perform the adhesive dentistry with a rubber dam, and even if the epithelium in the future will migrate slightly apical, the epithelium can be attached actually to the composite if it's shining and very precise. The important thing is to give enough dentin surface clean for the supracrestal attachment in the area of the papilla. And we check also with the periodontal probe, and we use this instrument as a probe itself. As you can see, this instrument is produced from a cavo, and there is with the contrangle in this way or in the other way. So you can use for the distal and mesial surfaces as well. With the probe, we check if it's everything fine, and it seems we reach an adequate amount of detachment, of bone removal, supporting bone removal to allow a perfect reattachment. Basically, the surgery is done. We don't need any suture. We just, with wet gauze, as you can see, with saline solution, we can just close. And you see now the x-rays. As you can see why there is a cavity, and the mesial surface of the implant is actually very good, and we don't want to damage, and we were able in that. So thank you so much. See you in the next